Welcome to Estero Today, produced by Engage Estero. I'm your host this week, Mike Wasson, and today I'd like to talk to you about a silent killer. The silent killer is important to me because of a personal experience I had 23 years ago. My wife convinced me that I should go for a colonoscopy. I had just turned 54. I was very fortunate. The colonoscopy determined that I had a precancerous polyp that was reattaching to the inner walls of my colon. After consulting a surgeon, it was determined that I needed to have a section of my colon removed. And sure enough, the surgeon did that in a surgery in July 9th, 2023, and several inches of my colon were removed. I was lucky. I've remained cancer-free since then. But what is particularly poignant to me is about 18 months later, a friend of mine and a business associate became sick. Harvey was married and had two young children. He was only 45, but 6 months later, he died of colon cancer. He had not had a colonoscopy. We know, and scientists tell us, that according to the American Cancer Society, the incidence of colorectal cancer in adults under 55 has nearly doubled, increasing from 11% in 1995 to 20% in 2019, which is the most recent data. Colon cancer is the third most common cause for cancer deaths in women, and it's the second most common for men. What makes this disease particularly dangerous is its silent nature. Dr. Janine Harewood, medical oncologist with Lee Health Cancer Institute, says colon cancer is actually very silent until it is too late. So we like to emphasize screening, she adds. Here's the symptoms. And when they do appear, they are often vague and easily dismissed. You feel abdominal pain, changes in bowel movement, constipation or diarrhea, blood in your stool, unexplained weight loss, or changes in appetite. By the time these symptoms become noticeable, the cancer may have already advanced. And there's a particular troubling trend. While the overall incidence of colon cancer has been declining since the 2000s in most populations, there is one troubling exception. The incidence is going down and the amount of people dying from colon cancer is going down for most populations, but Dr. Harewood notes, except for patients under the age of 50. Many experts believe that patients under the age of 50 may be linked to more colon cancer because of their dietary choices. We think that the rise may be linked to diet, and it's well known that diets high in red meat and processed meats have an increased risk of colon cancer, she says. But there's good news. There is the power of prevention. And prevention is that colon cancer is one of the most preventable forms of cancer. And the reason that is because of effective screening methods. Now, the gold standard for screening is the colonoscopy, like I got when I was 54 years old. Dr. Harewood strongly advocates that those 45 and older need to get a colonoscopy. And while colonoscopy remains the preferred method, Dr. Harewood acknowledges that other screening options exist. For colonoscopy, it's recommended every 10 years for the average risk of an individual. However, imaging, which involves a similar preparation to colonoscopy, but it also uses imaging technology instead of an endoscope. Imaging should be done about every 5 years, but if anything concerning is found, a follow-up colonoscopy is still necessary. Another technique is stool-based testing. Two types are available. One that looks for invisible blood, and it can be performed annually. And there's also DNA testing that detects genetic changes associated with colon cancer. That should be or could be performed every 3 years. But there's no question about the importance of early detection. Early detection saves lives. Now, the most significant risk factor for developing colorectal cancer is age. So more than 90% of all diagnosed patients aged 50 or older, according to more than 90% of all diagnosed cases are in patients aged 50 or older, according to the Center for Disease Control and Prevention, the CDC. The important thing is the stage at which colon cancer is detected dramatically affects survival rates. So start getting your screening earlier rather than later. Usually starting off at stage 1, the disease has a very good chance of being cured. The survival rate is almost always more than 80%. So catching it early is important. However, if you drop down to stage 4 cancer before it's detected, the chances of survival are somewhere around 30%. It's important that you develop a personalized screening plan with your doctor. They should be individualized based on your personal risk factors. So, based on what is found in your colonoscopy, you can develop a plan with your gastroenterologist about what your follow-up scans or your follow-up colonoscopies are, says Dr. Harewood. Know your risk factors. Understand what they are. Family history. Receive regular screenings. They can all help you cut your risk of developing colorectal cancer. Also, lifestyle factors, such as diet, can play a significant role in this increase. Poor diets that are low in vegetables, fruits, and fiber, and high in fat, red meat, and processed foods are associated with increased risk for developing colorectal cancer. Dr. Harewood continues, people with inflammatory bowel diseases such as Crohn's disease or ulcerative colitis are also high at risk. A family history of colorectal cancer increases risk too, she adds. Fortunately for us here in Southwest Florida, we have the support of the Lee Health Cancer Institute. For those that are diagnosed with colorectal cancer, navigating treatment can feel overwhelming. But the Lee Health Cancer Institute offers oncology nurse navigators. They are a dedicated member of the care team who helps guide patients through the treatment process, and they do it at no cost. These professionals provide education, support, and assistance in overcoming barriers to care. The Cancer Institute's Oncology Nurse Navigation System can help you with nearly every type of cancer. So if you or a loved one could benefit from the support and compassion of an oncology nurse navigator, ask your doctor or healthcare provider for a referral. Or I'm going to give you a phone number. Get a paper and pencil, write this phone number down. You can call for help. The phone number is 239 343 9500. Let me repeat that. 239 343 9500. We encourage you also, if you need more information, to visit esterotoday.com. Our website under the health programs can point you in the right direction as well. Thank you for joining me today. It's a pleasure that you can visit and learn more about Estero today. Engage Estero appreciates your presence, and we are here to help inform so that you can be better engaged and enjoy your life in Estero today. Thanks, and we look forward to you joining us again next week as we talk about things that are going on in Estero today.